I'd like to start off today with a brief introduction to the way in which we prioritise the allocation of resources, a concept that is embedded in a range of other initiatives. It's been addressed through a number of other beacons as well, particularly the Total Place and the Economic Prosperity beacons. You can find out more about them from the Communities of Practice. Strategic commissioning is also a theme within world-class commissioning in the NHS, and is part of the use of resources assessments that apply to both local government and the NHS. We've taken the familiar concept of the commissioning cycle with its four main tenets: the needs assessment, the specification of services, the procurement of services, and the monitoring and evaluation to see whether those services meet the needs of the local community. We've taken that cycle and looked at it from a strategic point of view within the context, first of all, of members and strategic executives setting strategic priorities, understanding the financial context within which we're working and the resources available, understanding the legal and statutory basis for our requirements, and then looking also at the non-financial resources that are available to deliver those. We've applied that commissioning cycle across the range of services that we have, and in particular looked at how we use that across departments and with other partners within the City Partnership. A really important part of how we target resources is around understanding the needs of our community. And we have in Westminster developed a particular model of the Joint Strategic Needs Assessment, about which you can find out more information on the Communities of Practice site. In particular, this is not just a document on a shelf. This is about a rolling programme of understanding the core information about our communities, but also constantly updating that to understand the changing needs of our communities and making sure that the services that we commission are based on how do we meet those changing needs. We've also got one information portal which we brought together council information and health information so that everybody's working to that same information source. We've also got one involvement strategy we're developing at the moment, a shared involvement strategy from the council and the NHS, so that we understand from the community their ideas of what they need and what they want, in addition to the more objective data about what the situation is in the local area. We've also been developing a joint performance framework, and obviously the comprehensive area assessment is the national framework, but we've looked at how we can develop the information for that together. The first example is around our Section 75 joint commissioning agreement between Westminster City Council and NHS Westminster, which enables us to commission services on behalf of each agency in a more responsive way so that we're able to meet people's needs in a coordinated way. Another example is, say, for Westminster Partnership, where the Council, NHS Westminster, the police and probation and other partners come together to develop more effective services to provide a safer environment for our local community. We have an initiative in Westminster, the Every Older Person Matters, which has emphasised the fact that the needs of older people are not just about health and social care, but are about the health and well-being, the access to leisure and arts facilities and so on. And we've been able to take that forward in a whole partnership manner, which has really been well received by the older people within our community. We've got two particular initiatives within the Living City programme. One is recognising about tackling overcrowding, which affects a whole range of other areas. For example, the achievement of children in schools, people's health and well-being, as well as the safety of an environment. And we've got a joint approach to tackling overcrowding. And finally, of course, Westminster's up there dealing with the environmental issues within a carbon alliance, which has brought all sorts of partners together to see how we can reduce carbon use in the city. We've been doing over the last few months public finance mapping, understanding what all the different statutory partners are putting into Westminster. We've also been looking at how we can apply the total place approach in Westminster, learning from those areas that have been total place pathfinders. We've been involving the partnership, the whole of the Westminster City Partnership, in the prioritisation of budgets. And we're moving to look at how we prioritise the whole budgets, not simply the local area agreement budgets as we have in the past. In Westminster City Council, we've been taking forward the Cause and Effect project, which has been looking at all the different aspects of what the council does, not just new initiatives, but the core work of the council, and saying, are we doing these things simply because we've always done them, or are they things that absolutely meet the local needs now and going forward into the future? We've been developing a stronger procurement and governance process, and we've also had, in response to the recession, a very effective economic recovery plan that has enabled us to cope better with the difficulties that the recession has made across the country. Finally, we've been transforming the whole council, as you will hear more from Mike Moore later in the day.